Hello, how are you? Before we start your cranial nerve exam, could you please tell me your name? Your last name. Okay, your home address. And your email address. Could you spell it? Wonderful. And finally your phone number. Okay, great. Good. Well, to start with, I'm gonna take your pulse. So, give me a moment. Take your hand. Okay. And I'll keep the track of time. Okay, it's totally fine. Well, now let's proceed with your face. Do you feel my hands symmetrical on both sides of your face? Wonderful. What if I press here a little bit? What about here? Does it hurt? Alright. Well, would you please frown for me? Wonderful. And could you puff up your cheeks? Okay, now let me close them. Don't let me, please resist me. Okay, wonderful. Now could you smile? Okay, great. And now could you please close your eyes? Close them and don't let me open them. Please try to resist me as hard as you can. Okay. Okay, wonderful. And now, once again, could you clench your jaws? Same way, now let me open them. Okay, great. And now we're gonna check your face sensitivity. So, there are two sides to the Q-tip. One is sharper and another one is just a cotton wisp. So I want you to close your eyes and just let me know if it feels sharp or dull, okay? I will touch you slightly with both sides. Yeah, and you will simply let me know if it's sharp or dull, okay? Great, so to close your eyes. Okay, good. Okay, that was sharp, wonderful. No. Okay, that was dull. Okay, no. Sharp. Okay, wonderful. What about no? Okay, that was dull. Okay, great. And now, basically very similar test. I'd like you to close your eyes and just simply let me know when you feel the cotton wisp on your skin, okay? Yeah. Exactly, that's right. So, have you closed your eyes? Great. Good. You can simply say yes, or when you feel it, or even just raise your hand. Okay, great. wonderful. That's great. And now I guess that we can start with your ear and eye exams. So let me inspect your ears just for a moment. Okay, great. The other one. Okay, what if I press on them? Does it hurt in any? Okay, I see. And now I'll have a look with an otoscope. So, please, just relax. It's alright. Okay, wonderful. Now the other one. Okay, good. Wow. And now, could you please tell me if you can hear the sounds on both sides equally well? Okay. Okay, and now could you tell me when you don't hear the sound anymore, okay? When it's too far for you to be able to hear it, okay? Okay, great. Okay, so now you don't hear it. Okay, great, and now let's try once again. Okay, got it. Well, now the other hearing test involves the tuning fork. I will put it on the top of your head first, and yeah, I'll ask you just a few questions regarding your hearing. Okay, are you ready? Okay, no need to close your eyes, but if you want to, it's totally fine too. So, can you hear it now? Okay. So can you still hear it? Would you please let me know when you don't hear the sound anymore? So now you don't. Okay, fine. Got it. Well, and did you feel it symmetrical on both sides? Let's try once again, okay? Does it feel symmetrical on both sides? Yeah. Great. Okay. And now I will put the tuning fork right behind your ear. And we'll do the same test. So you will simply let me know when you stop hearing the sound, okay? Yeah. So now you can hear it anymore, okay? And what if I put it this way? This way you can hear it a little bit. Okay, and now the other ear. Okay, once again, put it right behind your ear. Okay, so now you can't hear it. What about if I put it this way? Okay. Now you can't. Okay, great. Well, and now your eyesight. So let me have a look at your eyebrows, at your eyelids. Okay, wonderful. So now it's a very basic eye chart. You are definitely familiar with it, and I'm gonna show it to you. So could you please read this line for me? Exactly. Good. Wonderful. And now, could you please close one of your eyes and read the next one, the next line. I'm gonna help you. It's okay. Yeah, just like that. Okay. Yeah. Okay. Yes. Good. Good. Okay, wonderful. Great. And now, would you please close the other eye and read the next line? Yeah. Right below it. Okay. I can help you. Okay. This way. Good. Yep. Good. Good. Yes. Okay, right. Doing great. Now please keep your head still and simply follow my finger with your eyes. Okay. Okay. Good. Wonderful. Great. Now, please look straight at me and just let me know when you see my fingers wiggling. Okay? It's just your side vision. Okay. 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 Great. Let's try once again. Keep looking straight at me. My nose, if you wish. Okay, now you can see them. Okay, great. Let's try one more time. Okay. Okay, now you can see my fingers. Okay, wonderful. Good. Now, would you please look at my finger? Okay. And now look at the tree behind me. Now look at my finger again. Now look at the tree. Look at my finger. At the tree. Okay. Okay, let me check your pupils. Wow. Okay. Great. Okay. Now once again, could you please look at my finger? Okay. Alright, and this way. Now I will check your eyes from this side. Okay, just like that. This way. Okay, now the other one. Oh, okay, wonderful. And now could you please look at the tree behind me once again? Alright, and now I'd like to turn off the light, but please keep looking at that point. Right behind me, okay? Okay, just give me a moment. Okay, keep looking at that point. Exactly that spot. Wonderful, and now right. Okay, amazing. Please be ready. I'm gonna turn off the light again. Okay. Good. Well, basically that would be it for your eyesight, at least for now. And now please let me check your nose once again. Go this way. Oh, for now you don't need to do anything. Okay, could you please chin up a little bit? Just have a look at your nostrils, right? Like inside your nose. Okay, good. And now, just to check your respiration, could you please close one nostril with your finger? Yeah, just exactly like that. And could you please breathe in? Yeah. Okay. And the same thing with the other one. Okay. Okay, good. So yeah, you can breathe them both equally well. Okay, wonderful. Well, now your sense of smell, olfactory nerve. But once again, I will ask you to close one of your nostrils, okay? Okay. Could you please smell it? Just take a smell. Okay, wonderful. So, coffee this right here. Now, once again. The other one. Could you please close the other nostril? Just like that. Exactly. Okay. Now, could you please take a sniff? Okay. What does it smell like to you? Peppermint? Right, yeah. Wonderful. Well, now, the other thing. I'd like to have a look at your mouth. Could you please open it for me? Just keep it open this way. Okay. Now could you please raise your tongue inside your mouth cavity? Okay, wonderful. Now put it down. Could you please put your tongue to the side? And to the other one. Oh, okay, great. And now could you please stick it out? Okay. This way. Good. Now it's good. Okay, wonderful. Great. I know it's not the most pleasant feeling in the world, but still. Thank you. Now I'm gonna examine your neck. Gonna check your thyroid gland. Does it hurt when I press this way? Okay, great. And your lymph nodes. Yeah, I'm not supposed to actually feel them. Otherwise, if they're swollen, it means that, yeah, it should be that way. Okay, wonderful. Your trachea. Okay, great. Just this way too. Okay, great. And now I would like to ask you to swallow the water. Give it to you. Okay. Well, I'd like you to take a little sip, but please don't swallow it for now, okay? Just keep this water in your mouth, and just want to feel your neck. Okay, this way. Now could you swallow for me? Wonderful. Okay, now let's try once again. Take a sip. Wait, hold on for a moment. And now could you swallow it again? And now let's do the same thing once again. Okay. Okay, wonderful. Thank you. Excellent. Well, now your head movements. Would you please tilt your head to the side? Okay, now to the other one. Great. Now would you please put your chin up? Okay, now chin down to your chest. Okay, now would you please turn your chin to your shoulder? Okay, exactly. Now to the other one. And now the ear to your shoulder once again. Okay, good. And the other side. Alright, that's wonderful. Good. Well, and now, would you please shrug your shoulders? Okay. Okay, great. Now you can put them down. Okay, amazing. Well, and now the next thing. So, would you please show me your palms? Just like that. I'm gonna inspect your hands and your arms the way I did it with your face and your neck. Okay, we'll have a look at the lymph nodes. Okay, just right above your elbow. And then this one too. Alright, now it's totally fine. Okay, wonderful. Now, could you please close your eyes once again? And I'm gonna use the same cotton wisp, and for now let's start with the same sharp or dull test like we did with your face. So all you need to do is just tell me if it feels sharp or dull, okay? Yeah, great. So close your eyes. Okay. Sharp, okay, good. Okay, wonderful. Is it sharp? Okay. And then it's dull. Okay. Does it feel the same on both sides? Okay. So it's symmetrical. It was dull. Okay. And now that was sharp. Well, great. Now please don't hurry to open your eyes. Another thing, like the same as we did with your face. Yeah, just I will touch you really slightly with this cotton part, with the cotton wisp. So you just let me know when you feel me touching your hands or like your forearms. Yeah. So just relax and simply tell me like yes when you can feel it on your skin. Okay. Great. Alright, well, you're doing good. Now you can open your eyes. And let's check your reflexes. So let's start with your elbows. I'll use the percussion hammer for that, so it's not gonna hurt. Don't you worry. Okay, just give me a second. I'll just put it all aside. Okay, we're not gonna need that. Alright. Well, so let's start with your elbows. First, the inner part, the inner side of your elbow. Oh, okay. The other one. And now the outer one, the other side of the elbow. Oh, wonderful. Now a little bit above your wrist. Okay, now the knee jerk reflex. So could you please put one leg over the other one? Yeah, just bend them that way. Okay, exactly. Good. Wonderful. Okay, wonderful. And now your feet. Okay, great. Yeah, that's exactly. Okay. Now this way. Okay, that's good. Good. Wonderful. Well, now what I ask you to do is to flip your hand back and forth. Yeah, exactly, as fast as you can. I know it might look a little bit funny, but still, yeah. Okay. Exactly, just like that. Yeah. As fast as you can, as I said. Yeah. It's alright. It's alright. Good, good, wonderful. Okay, now your balance. Please reach my finger with yours, and then please reach the tip of your nose with the same finger. Okay? Yeah. Yeah. So it's gonna be like this, and like this. Okay? So, okay. Yeah. Keep on. Please look straight at me. Exactly. Okay. Good. And now your nose. Wonderful. Okay. Good. Wonderful. Now, once again, your nose. Okay, let's try with the other hand. The other arm. Just like that. Your nose. Okay, and once again. Okay. Okay. Okay, good. Alright, now could you please straighten both of your arms? And just the same thing. Reach the tip of your nose with the pointing finger. Exactly. Yeah. Okay, and now with the other arm, with the other hand. Okay. Okay, great. Good. Well, now would you please put your arms up for me? Okay. That's just like that. Let's check how strong you are. I will try to push them back. Just try to resist me as hard as you can. Okay, just like that. Okay. Okay, wonderful. Good. Now let's put your arms this way. Yeah. And once again, try to resist me. Don't let me push you backwards. Okay. Wonderful. Great. Now would you please straighten your arms and bend your wrists upwards. This way. Exactly. And don't let me put your hands down, put your wrists down this way. Okay. And now the other way around. Don't let me raise them. Okay. Okay, wonderful. Amazing. Now could you please spread your fingers this way? And don't let me put them together, okay? Okay, just resist me. Keep on resisting. Okay, wonderful. Would you please put together your thumb and your pinky? Okay. Okay, exactly. Once again, try to resist me. Okay, great. Good. Wonderful. Okay. Well, now your arms. Could you please put them behind your back? Just like that. Okay, okay, great. Now above your head, raise them above your head. And put them to the sides. You can straighten them fully. Okay, okay, great. Just let me take the notes. Okay, okay, wonderful. And now the tuning fork is back. So what I'm gonna do is put it next to your hands, and you will simply let me know if you feel the vibration and how long you can feel it and when you stop feeling it, okay? Okay. Let's do it. Can you feel the vibration? Your hand? Okay. Let me know when it stops. Okay. So now you cannot feel it anymore. Okay. Once again with the other hand. Okay. Yeah. Okay, now you can feel it anymore. Okay, good, got it. Well, and now I'm gonna touch you slightly. Please close your eyes, and I will just, press a few times on your fingers, and you'll simply let me know if how many times I did it. So it was like once or twice, okay? Okay, good. Good. Keep your eyes closed. Exactly. The other hand. Wonderful. Okay, great. Now keep your eyes closed. I'll just put some items in your hand, yeah? And you will have to feel it and let me know what it feels like, okay? Okay, good. So now, can you guess the item? Hairpin. Exactly, wonderful. And now, what now? Lighter. Yeah, exactly. Well, okay, great. You can open your eyes. Good. And now the other thing. Would you please lean and reach your toes with your hands, with your fingers? I mean, as much as you can. It's not about flexibility, really. It's just about balance. And I'll try to push you once again. So just try to maintain your balance. Okay. Good. Oh, wonderful. Well, I guess that's it for today. You did really well. Yeah. Sure, do you have any questions? How are you feeling? Okay, great. Yeah, I'm really glad to hear that. It's really nice that you even managed to enjoy the exam and the process. That's great. Right. Yeah, well, email you your results. Exactly, okay. See you soon. See you. Have a good one. Bye. Hi there. Yeah, sure. Come in. I've been waiting for you. Alright. Well, how are you? Oh, we're really glad to see you here. As far as I remember, you're here for your cranial nerve exam, am I right? Okay, wonderful. Wow. You can sit comfortably right in front of me. Yeah. Is that chair comfortable enough? Alright. Great. Well, let me confirm your personal data really, really quickly, okay? So your first name would be... That's right. Basically, I have everything in the system, so I just wanted to verify a few things, okay? Your last name? Right, that's what we've got. Your home address? And your phone number? Right, that's exactly what we've got. And your email address, could you spell it, please? Oh, that's so fast. Okay. Great. Right, okay, everything seems to be just fine. Well, how have you been feeling lately? Would you like to tell me anything? Any issues that would be concerning for you? Okay. Have you had any kind of injuries lately? Been in any kind of accidents or something? Have you had any infections related to your nose, throat, and any ear infections? Okay. Okay. Got it. Right. Well, when you wake up in the morning, do you feel any kind of dizziness? Do you ever have any migraines, flashes for your eyes? Any other kinds of headaches? Pain in your neck? Any kind of numbness in your face so that you wouldn't feel some part of your face or something? Okay. See, got it. Right. Okay, a few more questions. How often do you drink, if you drink any kind of alcohol beverages? Let's say how many times a month or a week or a year, so it really depends, like just approximate frequency. Do you smoke? Yeah, I mean tobacco. Well, then talking about sports and other like physical activities. How often do you exercise? If you exercise at all? Yeah. Of course, it's extremely important for you, but right. How would you actually, let's say, like assess your physical activity from 1 to 5, where 5 is like very often that you exercise or workouts almost every day, and 1 is when your physical activity is quite low with minimal exercising and stuff. What kind of physical activities do you prefer? Yeah, it's more like off the record question. Just wonder. Right, okay. Got it. Right. What about your diet? Do you think you consume enough carbohydrates, fats, proteins, and all these macronutrients and micronutrients as well? Right. Okay. Yeah. How many times a day do you usually eat? How many meals do you have? Do you belong to those people who usually skip their breakfast? Okay, got it. When it comes to your blood pressure, do you have hypertension, any other kinds of issues? Yeah. So usually is your blood pressure within normal, or would it be too low, too high? Got it. I see. Alright. Well, I might have some more questions in the process, but for now, that will be it. Right, thank you so much for your honest answers. Yeah, sure. I'm a doctor. I will never judge you, so you can tell me anything. Of course, it's important if that's like you're honest with me, then it will be easier for me to come to some conclusions and just to evaluate your general condition. Sure. Okay. Well, first, since it's your cranial nerve exam, when was your last one, by the way? Well, I just wanted to remind you a little bit that in general we're gonna inspect all 12 cranial nerves today. Yeah, so basically you don't really need all this medical information, all these details, but just in case you are wondering, just in case you're interested, so I can tell you a little bit more in the process, okay? Yeah, so here on this picture you can see how they actually, where they are located, like more or less. Of course, it's very, very like approximate, it's very rough depiction of what is going on in your brain, but still. And here you can see different groups of cranial nerves. And today we're gonna examine all of them. It's actually easier than it sounds. Yeah, it might seem like it will take us like a few hours, but not really. So there are a lot of really simple, really accurate tests that will show us how well all these cranial nerves function. Yeah, of course. So I will tell you a little bit more in the process, right, as we go. Sure. Okay. Just a second. I will just. Okay. Good. Well, so I guess that we will start with your olfactory nerve. And olfactory nerve is basically it's more about your sense of smell. If in other words, right? So it's not something really unusual. So it's what you use every single day. Have you noticed any changes in your sense of smell lately? So do you think that you perceive all the smells as you used to? Has it ever happened that you would feel the smell that nobody else could feel, or vice versa? Okay. Have you noticed maybe some changes in what certain items used to smell like before and what they smell to you right now? Like how they smell to you now? Yeah. Got it. Right. Okay. Well, I suggest that we get down to check it. Okay. I'll get some cotton swabs, right? And I will just let you smell different kinds of testers. So there will be quite a few of them. Yeah. And before we do that, I'll just spray this sanitizer onto my hands. Yeah. So I will also put on my latex gloves a bit later when I have to touch your face, but yeah, for now that will do. Okay, great. So I'll get some stuff and we'll see how well you're able to differentiate between those kinds of smell. Okay, please take a smell. There's no hurry. You can take as much time as you want, as you need. But I suppose that it shouldn't be really that challenging, right? So what did it smell like? The citrus. Absolutely right. Okay, great. Now on to the next one. Please take a smell, a sniff. So what does it smell like to you? Right. Are you sure? Peppermint. Exactly. Great. Now another one. Alright. About this one. Chocolate. Amazing. Okay, great. And let's do one more. So far you're doing really good. Cinnamon it is. Amazing result. Okay. And right away there's a facial nerve that together with olfactory, it basically is responsible for your sense of smell and for your sense of taste, right? So the same as glossopharyngeal nerve, okay? So let's see how your sense of taste works. I will just ask you to stick out your tongue, and I will drop a tiny amount of this syrup onto it. Okay, so would you please stick out your tongue? That will do. Okay, wonderful. Okay, great. So, what kind of taste is it? Sweet, right? Yeah. Great. And let's get one more. Great. So what now? Okay. It's bitter, right? Yeah. Amazing. Okay, great. Thank you. Thanks a lot. Wonderful. Alright, well, now I will test your eyesight. I use the light. It's gonna be a little bit bright, but that's how we're gonna test your pupil reaction, okay? So just relax and let me have a look. Okay. There's the other one. Wonderful. Okay, now put my hand right in the middle between your eyes. Okay, perfect. Okay, that's perfect. Great. Thank you. Okay, now I'm gonna test your corneal reflex right away. The blink reflex, in other words. So, you can just look at my nose or wherever you want. I'll put this brush a bit close to your eyes, close to your face, but please don't be scared, okay? So, I won't put it right in your eyes, so don't worry about that. We'll just see how your blink reflex works, okay? Exactly, great. Okay, wonderful. Now it's fine. Good. Okay, now I will ask you to trace the light with your eyes only, but please don't move your head, okay? Now please concentrate on my nose. We're gonna test your peripheral vision. I will ask you to tell me when the light appears in your field of view, in your field of vision, okay? Great, but please look at my face. Don't look at the light directly. Thank you. You can simply nod or say yes or whatever, even raise your hand, doesn't matter. Great. Wonderful. Okay, and now let's do the opposite thing. Please just tell me when it disappears from your vision, okay? Thank you. Alright, thank you. Now let's do similar thing with my fingers, okay? So just let me know when they appear in your field of vision. On both sides, please. Okay. Now with another one. Wonderful. Thank you. Right. Now just tell me when my fingers wiggle on either side, okay? Alright. you. Alright, you're doing great. Okay, now just follow my fingers once again with your eyes only. Yeah, perfect. Okay, great. Now please look at my nose and tell me how many fingers I'm holding up, okay? Okay. Okay, great. Thank you. Did really so good. Now let's just quickly test your vision acuity. Okay. So I will show you a Snellen chart. It's pretty standard procedure. Okay. So I'm sure you have seen it many times. I even have the one behind me, right? So the big one. But today I will show you a smaller one that is a little bit closer to you. Would you please tell me which is the smallest line that you can still see enter it? Okay, would you please read it for me? What about the very lowest, the very smallest one? Can you see it? Let's give it a try. Right. That's alright, that's totally fine. And finally, your color vision. Let's test if you can possibly be colorblind or not. So it's not gonna take too long, I promise. I have some Ishihara tests. So, okay, I'll put it this way. It's a pretty challenging one, but still, would you please tell me, can you see anything here? It's not easy. Anything at all. So you can see the square. Can you see anything inside the square? Like I said, it's quite challenging. Okay, great. So there is a circle of some kind. So yeah, like letter O here. Right. Can you see it that way? Okay, wonderful. What about this one? Can you see anything here? Okay. Letter X. Right. Thank you. What about this one? Can you see anything? Any shape, any figure? So there's like a curve similar to letter S. Right, you're like a snake. Okay, great, amazing. Good job. Okay, great. What about now? Can you see anything in this chart? What is it similar to? Letter W. Okay, amazing. And in this one, is there anything? Can you see any shapes maybe? Figures. Also like a curvy line. Okay, would you please trace it for me? There it is. Okay, amazing. So I started with really challenging tests, but you nailed them. Okay, I will show you a few more standard ones. Let's see if you can see anything there. So what about this one? How many circles can you see in the picture? Okay, great. Right, so please tell me, what can you see inside them? Any numbers? Okay, awesome. What numbers can you see? about this one on top? Okay, great. And this one? Wonderful. What about this? Okay, this one. Okay, this one. Amazing. And finally this one. Wow, you're doing really good. So your results are quite impressive, especially taking into account that I showed you really difficult ones. Okay, so you're not colorblind. I can guarantee you that. Now, I'll just put on my gloves and have a look at your mouth, throat, and your nose, okay? Great. I will also use the otoscope and the spatula. Okay. Would you please open your mouth? Wonderful. Okay. Would you please stick out your tongue just a tiny little bit? Thank you. Just have a look. Right. Okay, great. Now, could you please move your tongue? Let's move it to the side. Yeah. You can move it like that, like against your cheek, like this. Okay. Okay, great. And on the other side? Wonderful. Okay, great. So, hypoglossal nerve is working just fine. Now, let me have a look at your mouth once again. Now, let's say, okay, great. Now, your nose. Wonderful. Let me do the smear first. Wonderful. Okay. Great. Now could you please close one of your nostrils? Yeah, with one hand. Exactly. And breathe in. Breathe out. Okay, wonderful. Now the same thing with the other one. Good. So you can breathe with both of your nostrils just fine. That's wonderful. Oh. And your hearing, can I look at your ears? What if I press like that? Okay, great. Now I will make some noise on one side and I will just tell you some words, okay? So you will just tell me what you heard, okay? Living room. 41. Great. Now to the other side. Glasses. 68. Okay, wonderful. Now the other side again. Lipstick. Great. Now the other side. Windsurfing. Snellen chart. T-shirt. Football. great. Now I will ask you to close your eyes and tell me which side, which ear the sound is on. Okay. Thank you. Are you ready? Amazing. What about now? Are you sure? Let's try again. Let's double check. Okay, what about now? And now? Okay, wonderful. Now, could you please look at me? Okay, I will ask you to give me the widest smile possible. Thank you. Okay, now to please clench your jaws. Like that. Don't let me roll your chin down. Don't let me open them. Okay, thank you. Great, puff your cheeks up. Okay, exactly. Hold there. Don't let me close that. Okay, thank you. Great. Now could you please swallow for me? Yeah. Okay. Okay, great. Now raise your eyebrows. Good. Would you please frown at me as if you are angry? Thank you. Shrug your shoulders, please. And now could you please raise them and don't let me put them down. Okay, wonderful. Great, thank you. Okay, now I will just have a look at your eyes for another moment. Everything is just fine. Would you please look up once again? Look down. Once again, look up and down. Look to the side. To the other side. Now, would you please close one of your eyes? Do the same thing. Look to the side. Follow the light for a moment. Now, please close another eye. The other one. Once again. Okay, great. Awesome. Right, now let's check your sensation. I will poke you really slightly with this tip of the brush. It's not really sharp or something, so please don't worry. Yeah, it's not gonna hurt. Please close your eyes and tell me when you feel the touch. Great. Wonderful, okay, great. Now, let's check your reflexes, right? Really quick. Do you need your reflex? I would ask you to put one leg over the other, bend them the way. Exactly, now you know what to do. Wonderful. Now I will just put my fingers under your chin, okay? Don't worry, I will just put it slightly like that, exactly. Okay, great. Right, well, do you have any questions? I will just enter some of your results. Yeah, thanks for your patience. Thanks for your time. Everything works just fine as it's supposed to function. So it's alright. Once again, is there anything else you'd like to tell me? Maybe you remembered some other issues you've had lately. Okay. Perfect. Okay, great. Well, then I have to let you go. Thank you so much. Oh, you're really welcome. Yeah, it's been a pleasure to work with you. Have a good one. Yeah, sure, thank you. Yes, absolutely, I'll see you soon.